Hello, welcome to our Stress First Aid Briefing. My name is Dr. Mayor Ballison and I am the Director of the Center for Traumatic Stress, Resilience, and Recovery. We're here to share information about providing better support to team members affected by stress and to equip you with some tools to help in that process. Stress First Aid is a peer support process, so I would like to introduce you to our two team members who will guide you through the rest of this briefing.
Hello, my name is Kelly Serra. I am the nurse manager for One North at Zucker Hillside Hospital. Stress is a complicated term and sometimes can in fact be a powerful, positive, motivating force for improved performance when encountering difficulties. However, if it builds up to become too much over time, or if it's an acute type of stressor, such as a trauma, it can create some significant impacts on our health and well-being. We hope that the tools within the stress first aid model can help you to better identify and manage stress reactions for your peers and for yourself.
Hello, my name is Alicia York. I am a nurse manager at Zucker Hillside Hospital. Stress First Aid is a framework to help improve recovery from stress reactions through peer support, and it is focused on activities that can be engaged in both for oneself as well as in supporting your peers through practical sets of actions that can be used whenever they are needed. Stress First Aid is a peer support model because team members support a critical ingredient for making our work enjoyable and because we are each other's first line of support. SFA addresses stress reactions before they create problems, and in doing so can help to create longevity. It can also help us reduce stigma around stress by helping us to change the culture of stress. It does this in part by creating a common language for all of us to use when thinking about and talking about the stress we feel on the job, as well as from day to day circumstances.
At the heart of stress first aid are two foundational tools for first identifying stress and stress reactions, and then knowing what to do. In front of you is the first tool called the stress continuum model. This was adapted from the operational stress continuum utilized by the Marines. We all react to stress and have different ways of coping with it. The stress continuum helps us place stressors as well as stress reactions on an escalating continuum of severity. In the green zone, for example, a person is experiencing minimal stressors and therefore is functioning at their best. In the yellow zone, someone is experiencing transient kinds of stressors, such as some passing financial problems or relationship issues. And this leads to some increased stress, such as feeling more irritable, having more difficulty sleeping, or other negative reactions. In the orange zone, however, the stress is escalating in terms of either the intensity, such as experiencing traumas of life threat, or moral distress, being forced to do things against one's ethical values, or maybe increased grief from too many losses. There can also be too many yellow zone type of stressors, essentially too much excessive everyday types of stressors. In the orange zone, a person's functioning is starting to be compromised, and one might feel more panic, guilt, or anger. If this hardens over time, if we stay in the orange zone for too long, we might enter into the red zone where we might be experiencing reactions like anxiety, depression, or PTSD. Most importantly, we're essentially not able to function and do our daily activities as we typically would. The goal of the stress continuum is to help identify these reactions early. Your role is to move stress reactions towards the more manageable colors of yellow and green for yourself and for peers by catching it early and taking the appropriate steps depending on the level of stress. Once you have identified the signs of experiencing stress and you've noticed which color zone you are in, you can begin to think about taking action for yourself or for colleagues. If someone is in the orange or red zone, it becomes critical to use the 7 C's of stress first aid.
The 7 C's of stress first aid is helpful for organizing our thinking about what exactly we need to do when experiencing more stress. The first 2 C's include check and coordinate. These are called continuous actions because essential at all points in time when you may want to be checking in with a colleague or even with yourself to assess, observe, and listen regarding what kinds of stress, feelings, and reactions a person is having, and then coordinating to find and use the right resources as needed. The next C is cover, which is about getting to safety as soon as possible. If in fact a person is having a strong reaction out of feeling in danger, perhaps maybe due to a exposure for COVID or to a patient that may be dangerous. Next, we think about calm, which is about relaxing, slowing down, and refocusing our bodies by having some sort of calming intervention, like relaxation or breathing exercises. Fifth, we can think about connecting to trusted colleagues or maybe to loved ones or other supports that can provide some grounding and stability in a time of feeling stress. Six, we think about competence, which is about restoring effectiveness and problem solving through difficult moments by learning the skills and techniques we need to deal with the stressful situation. Lastly, is confidence, which is about achieving self esteem and hope in the face of feeling stress and diversity.
The basic skills of stress first aid can actually be broken down into 3 core constituent parts. The first is to recognize when a coworker or colleague or you have a stress injury. The second is to act, that if you see something, that you either do or say something, either to the distressed person or to a trusted support of that person who can in fact help that individual. And lastly, it's critical to know at least 2 trusted resources that you can access or that you can offer to someone when they are in distress.
In order to help you support your peers, we want to share with you some resources that are available to you across the continuum of stress levels. In the green zone are resources to help maintain ongoing well being. They can be used all the time, even if we are feeling high level of stress. In the yellow through red zones are additional level of support that can be used depending on your need. These include resources from within the system and links to the community. This concludes our briefing on stress first aid. We hope that you found it useful. This was only a brief primer into what the model can offer. We hope that you can use some of these basic skills to begin thinking about stress in your team and what you can do to respond to those stresses over time. We look forward to supporting you with additional resources and options over time to deepen the use of this model in your setting. Thank you.
Thank you for participating in this Stress First Aid briefing brought to you by the Center for Traumatic Stress, Resilience and Recovery, or CTSRR. If you would like to learn more about how CTSRR can bring stress first aid to your team, please reach out to us at 833-327-1001 or email us at ctsrr@northwell.edu. In addition, please know that CTSRR is here for you and your family members if you are experiencing stress reactions and would like brief resilience coaching to build resilience, or opportunities to address associated behavioral health conditions such as anxiety and depression that could be related to stress. You should know that our staff are licensed behavioral health providers that are skilled in assisting individuals with conditions related to stress. Our services are confidential and sometimes at no cost. Thank you again.